So what are the main changes proposed in the Developing the Healthcare Workforce consultation?
Right, well there are two big changes, both organisational really. The first is the formation of something called Health Education England, which is a national body. It will be a special health authority, a new NHS organisation, and the Secretary of State's got permission, because obviously the arm's length body review is actually reducing the number of bodies. And Health Education England will take on a lot of the roles that the Department of Health currently undertakes for workforce and education. And it will be looking at the overall quality, it will be looking at the way in which money gets allocated out, and it will be looking at producing a national commissioning plan for workforce. And then locally, what you have is provider, well I'm going to call them workforce and education networks, and they're groups of providers coming together to undertake all of the things that we currently do at SHA level. So that's doing all the workforce planning, all the local education commissioning, and all of the functions around the deaneries. So it's when I looked at the list in terms of the activities for the provider networks, it's kind of the job description for the SHA Workforce and Education Directorate. And so we'd expect those then to take over. And part of that's about the SHAs being abolished, and therefore our functions need to go somewhere. But more importantly, it's about getting closer to what providers want. Providers are the people who have most of the workforce, and therefore it's much more appropriate that they're much more closely engaged with us designing what that future workforce ought to be, because it's their future workforce.
Okay, so why are we making these changes?
Well, part of it's because of the thing I just said about the SHAs being abolished. You know, that if we look at our track record, certainly in the North West, we do pretty well on all these things. All the external visits that we've had, all of the kind of quality assurance visits say that we're doing a good job, and a lot of our stakeholders tell us that as well. They say we work well in partnership and that we respond quite well to what people want. So in a sense, there's no sense that we ought to particularly change things. But if the SHA is abolished, then we do need somewhere else to go. So we then need to think about, well, what's the best way of actually trying to improve it? And we've always been strong in terms of trying to improve the quality of what we do, in terms of quality of education, the quality of the workforce plans we have, and of course the quality of the doctors and the other professionals that we've got coming out at the end of our programmes. And that's got to be a good thing for the patients and the people of the North West. So by focusing on that and then thinking about what providers want, as well as taking into account very strongly professional views as well, we think we can enhance that quality, that we can get better at what we do. And I suppose that's the real change for us, is trying to make sure that throughout all these organisational changes, we don't lose sight of the overall aim that we're trying to produce, which is great healthcare professionals for the future workforce for the North West.
Fantastic, thank you. And how will the proposed provider networks actually work in practice?
Right, well that's quite, I mean a lot of this of course, and I should have put a proviso at the front of all of this, which is this is all subject to the consultation, because the consultation only closed at the end of March, and with the pause, the natural break, then all of these sort of changes are going to go back by 3 months, although we're going to continue to plan on the basis of what might come about. So we're not stopping what we're doing, but we're maybe slowing bits of it down. So one of the things that we don't know for certain is what's the form of the provider networks. But we've got some pretty good ideas about this. During the consultation process, throughout all the stakeholder events we had, and all the networks we went to, and all the people we individually went and saw, and so on, we also asked them the question about how many networks and what should be the kind of shape of the networks. Yeah. And we sort of gave them 3 options. We said we could have one network for the whole of the North West, but we thought that wasn't really getting very close to employers. It's kind of just repeating what we've got at the moment. We could have 3, and the 3 that we thought of were Cumbria and Lancashire, Cheshire and Merseyside, and Greater Manchester. And we thought of those 3 because there is a natural coming together of networks. If you look at HR director networks, medical director networks, some of the chief exec networks, they do meet on those particular footprints. And there's also something about those footprints being akin to the way in which a lot of the patient flows work, which again is how a lot of the providers would work as well when they work together. So we think that those 3 patches are probably a good fit. And the third option would be if you said, well, there ought to be more than 3, or else if we drew in, say, particular specialties, so we could have a mental health network and so on. But we've only got a only a small number of people in the SHA who do this kind of work. In my team, there's only 11 in the workforce planning team. There were slightly less than that. So to actually divide those people up beyond 3 actually makes it quite difficult.
Yeah.
So we think that if you had a larger number than 3, there just simply wouldn't be the numbers of people. You'd be talking about trying to run a network with maybe 3 or 4 people. Mm-hmm. So we think having 3 is probably the right thing. And we went and asked that question, and the consensus that we got back was generally, yes, that's the right thing to do. And also that there ought to be some shared services between those 3 as well, because we've got some people with really good expertise, and we want to make sure that expertise was available to all 3 networks, not just the one where they particularly are located. Mm-hmm. And that's particularly so as well of one of our deaneries. One of our deaneries, Mersey Deanery, matches with that Cheshire and Merseyside footprint. Right. But the other deanery covers 2 footprints, two network areas. And we don't think that it's practical or appropriate to divide up that deanery into 2. So it's very much that we want to see that deanery as being a shared service between those 2 networks. And then you've got things like finance, where again we want to share that between all 3. Yeah. So there are a number of practical reasons for coming down to the 3. Now, how the networks work in practice is that we'd expect to continue a number of our functions, but have a governance framework which means that we're much more closely aligned to what providers want. Mm-hmm. And that doesn't mean simply that we consult a lot more, it means that the decision making at the end of where we have placements, of the numbers of trainees that we're going to have and the numbers of training commissions we're going to have for all of our different professions, that those decisions would be taken collectively by all our providers, because they're the ones, in a sense, as I said, for whom we're trying to get that future workforce. Now, there's some problems with that, because there is potential conflicts of interest. You know, if we're actually going to take trainees away from one trust and give them some more to another, or if there is a particular thing which one trust is particularly interested in, it's how do you get that collective view that isn't biased. Mm-hmm. So we're going to have to be really careful about how we design the governance of the way in which the networks will work in practice. And again, that's kind of the practical stuff which we'll need to work on over the coming months. And we also talked to the Department of Health and some of the working groups that they've got as well around this. But we have got some really good experience in the North West. We've got some good experience for 2 of the activities we have which are hosted. We've got the Leadership Academy, and they've got a very careful and strong governance framework with people effectively elected from particular mandated groups in particular areas. We've got the Aqua, which is again got a particular governance framework to ensure that its members are very much engaged with what Aqua does and where it wants to go and so on. And we've also, going back a few years, got the experience of the Workforce Development Confederations that we had in the North West, and some of the good things that were there about those, but also some of the things that we know didn't work so well. Mm-hmm. So it's learning from those lessons to make sure that we can actually really make sure that these networks take off and actually are successful in doing that employer engagement. Yeah.
So what will be the legal status of these networks?
Well, at the moment, there has to be a legal entity. Yeah. Because in some form the network needs to employ the staff. You know, we can't just be there and wander around without having an employer of some kind. And also they'll be the holder of contracts both with all our universities and also all the contracts we have with all the foundation trusts, the learning and development agreements and so on. So it has to be a legal entity. Our preference, and that's again based upon the experience we've had with the Leadership Academy and Aqua, is to go for a foundation trust hosting model. And we've begun to have some discussions about how we might actually do that. But that may be difficult. It may be difficult in terms of whether Monitor will allow us to do that. And there are potential issues around conflicts of interest for that host FT, because we couldn't have a contract with it, of course. That we'll need to resolve and need to work through. But that's our preference. I think we also need to be aware of the relatively short timescale, even with the pause, for kind of setting all these things in train. And the experience we've had with transforming community services, where we were transferring services into foundation trusts, and the amount of time that took in terms of Monitor's assessment of those transactions may make that quite problematical. So we're also looking at a kind of a plan B for kind of safety's point of view, because once course, the SHA's gone. It's actually gone, so we do need to transfer these over in a safe way.
Yeah.
And that Plan B is a contingency that we're looking at as well.
Okay. So who's actually organising this transition in the Northwest?
Right. Well, I'm taking on the leadership role as the director of the directorate, and I've been doing that with the senior leadership team. And that's the two postgraduate deans, Jackie Hayden and Dave Graham, and my two other associate directors, Rachel Charlton and Joe Rafferty. And we're kind of the leadership team that was very much involved in the consultation. But what we've decided to do, and what we've actually had our first meeting of as well, is set up a programme board made up of representatives from the providers. Because if we're going to become provider networks, it's very appropriate that at a very early stage we engage with those people as well.
Yeah.
So we invited expressions of interest, and we kind of had 5 categories which we think are the five key networks. So we wanted a chief executive, we wanted a medical director because of all the links with medical education, we wanted a nursing director because of all the links with nursing education, we wanted an HR director because of course so much of this is about workforce and workforce planning, and there's those strong links with that as well. And we wanted a finance director because this is also important in terms of the financial flows that we've worked. So what we've done is we've chosen from the people who came forward, and we've tried to produce a balance between the 3 kind of areas and also the organisations that these people are coming from. So we've got a primary care organisation, we've got a foundation trusts, we've got mental health, we've got a teaching hospital and a non-teaching hospital, so we've tried to cover all the bases. So the 5 people are Julian Hartley, who's the Chief Executive of University Hospitals of South Manchester, and also coincidentally chairs the North West Leadership Academy Board as well. We've got Gary Francis, who's the Medical Director for Aintree. We have Sally Parnaby, who's the Director of HR and Organisational Development for North Lancashire, and who also is one of our lead employers for employing the junior doctor trainees from one of the deaneries. And we have Bill Gregory, who's the Finance Director at Stockport FT, and we have Ray Walker, who's the Director of Nursing for 5 Boroughs Partnerships. And we know that between them they've got a lot of really good experience and have been very much strongly engaged with this as well. But we've also talked about the fact that although we need to have a small programme board to be able to make decision making appropriately and so on, we need to have very strong engagement with all the other providers. And we'd be hoping that those people will obviously link with their particular networks. We talked today, for example, about there being representatives of each of those kind of professional networks in each of the 3 areas. So Julian Hartley is there representing all chief execs, but maybe we can make sure that he links with a chief exec in Cheshire and Merseyside and a chief executive in Cumbria and Lancashire to make sure that they're very much tied in, and he doesn't feel he's got to talk to all of the chief execs, he can do it through those people. Yeah. But we're also going to set up a kind of a stakeholder group, which will probably be mainly a virtual group, but which we may invite along to a couple of workshops over the coming months. And the purpose of that stakeholder group is to engage with people with some of the ideas that we're coming up with, so things like the governance framework and how that should work, and really getting into the detail around how that might work. And also as we go through the FT hosting process as well, and again, making sure that people understand how that will be. Now we think that having that stakeholder engagement will mean that a lot more people can contribute, a lot more people can hear about the things that we're planning to do, and also a lot more people can make sure that what we're doing is the right thing to do as well. Yeah. So we hope that that process will work appropriately, and we're thinking about using lots of different media. In fact, we may do another podcast separately on how we progress on this as part of that, but we're also going to use other approaches to that as well.